Today we'll be meeting three personalities, three athletes who was diagnosed with hip AVN, defeated it, that too without surgery, and returned back to their professional lives healthily, and it did very good professionally after that. So all three of these athletes are baseball players, very famous, very legendary in their own terms, and have ruled the baseball in American history. So the number one player is Mike Napoli. He was diagnosed with hip AVN when he was just 30 years old and the peak of his career. However, after getting the right treatment and from the right place, he recovered back to professional sports, did wonderfully great, and never had to undergo further surgery. The next example is Bo Jackson, another baseball player from America who was diagnosed in 30s with the hip AVN, again underwent the medical management, completely avoided the surgery, and played baseball for another 20 years after the diagnosis of hip AVN and did extremely good professionally. Number third is Brett Favre, who was playing football, diagnosed with hip AVN in again early 30s, never received surgical treatment, never needed surgical treatment, underwent medical management at the right time, and played football for 25 years after diagnosis of hip AVN and did extremely good professionally. However, if you notice a common pattern in all these three super athletes is that they were diagnosed at a very early stage of hip AVN. That is stage 1 of or stage 2 of hip AVN, and they received the proper medical care, followed it diligently, which helped in complete recovery of hip AVN without leading to any kind of progression of hip AVN, which prevented any kind of hip replacement surgery. And at the same time, after healing of hip AVN, they went back to normal, playing high intensity professional sports like baseball, basketball, football, and many other activities. So if you have been diagnosed with hip AVN still in the early stages, you do not need to be worried about whether you'll be able to live a normal life or not, because hip AVN is completely curable. You can live a normal life. You just need the right treatment from the right doctor at the right time.